Hello, everybody. Hi. So my name is Unique Moore, and I work for CRISP. I do a lot of different things. I do account management. Oops, sorry. I do account management and pretty much onboarding, training, presentations, and a lot of the fun stuff. So my question for you guys before we get started, and please just regard the summer 2019 because I meant to change it to make it say fall, but just,
It is not fall yet. Refuse to accept.
it feels like it today. It was just warm on Wednesday. Now it's like kind of chilly. So my first question for you guys is how many of you are familiar with CRISP? That's great. How many of you are actively signing in every day? Some hands went down. It's okay. I get it. And my last question is how many of you have a CRISP rep or know who your CRISP rep is? Okay, that's good. And because you guys are in the Maryland Primary Care Program, you guys should have a coach from CMS, which we call the Maryland Primary Care Coaches. So how many of you have one of those? That's great. Okay, so we can move forward. You guys have to do this pre-survey before I get started. So if you guys could do that, that would be great. So right now we're just going to do a brief overview of our services and how CRISP plays into the Maryland Primary Care Program. We're going to go over care alerts and panel management. We're going to go over ECQM reporting, using reports to target specific areas, and upcoming releases and a discussion. And we'll probably do a question and answer portion as well. So right now, CRISP is a health information exchange. So basically, we're connected with every hospital in Maryland. We're connected in West Virginia and District of Columbia. We recently got connected with DC, but we've always been connected with Maryland hospitals since 2008, which is when we were founded. So basically, the whole idea of CRISP is so that providers, this is in the hospital level, private practice, this is even in hospices, SNFs, and urgent cares. We want everybody to know where their patients are and what they're doing. And how you access this information is by simply signing into our system. And that's literally all it is. Our service is the website is very user-friendly, If you are actively using a EHR, you should have no problem with signing in and maneuvering around the website and searching patients and pulling important documents that you need. So we have 5 different core services, and the main ones that everyone will be using is the care coordination part, population health, and public health support. So for point of care, we have a clinical query portal, and in this clinical query portal is where you'll get pretty much the bulk of everything. This is where you get admission, discharges, you'll get radiology reports, lab results, and you can also see some imaging. Literally everything that you pull up on our website is yours. You can save it to your EHR. You can save it to your EHR. You can also print it and put this information in the patient's chart if you want to do that as well. As far as care coordination goes, we have a service called ENS, or Encounter Notification Services. This is the main one that you'll be using for this MDPCP program, because this is where you get live hospital alerts. Every time a patient is admitted, discharged, or transferred from any of the hospitals in Maryland, DC, or West Virginia, you'll get a notification. And we also like to call this the ADT feed, admission, discharge, and transfer. So just saying a patient went to one hospital and was transferred to another, you'll get an alert. When they get admitted, you'll get alert. And when they get discharged, you'll get alert. Population health. So we have another service called CRISP Reporting Services. And you'll mainly use this for Maryland Primary Care as well. And basically, it's use case mixed data with a lot of the Medicare claims and everything that you'll need to do those like quarterly reports that CMS requires. For public health support, we're working with the Maryland Department of Health, and basically not sure if you have a lot of patients going to West Virginia, but they have West Virginia information here as well. And basically for program administration, we're making policy discussions more transparent and informed, and we're supporting care redesign programs. CRISP has committed to support the Maryland Primary Care Program in the following 3 ways. CRISP will enable certain health information exchange tools, which participating practices must use to facilitate better care coordination. CRISP will provide claims-based reports to each participating practice for tracking progress and providing interventions. And CRISP will aggregate the quality measure submissions from participating practices to submit to CMS. So if you sign in every day, you will be familiar with this one page, and it's called the Unified Landing Page. And this is the main page. And here, It's really, really small, but you can't see it. But we have a few tabs up at the top. We have a home tab. We have a home, I'm sorry, I forgot. I didn't know I had this feature. So we have the home tab, the prescription drug monitoring tab, the query portal widget. It may not say widget for you guys. The patient snapshot, prompt, and what is this one? Panel management application. So when you sign in, you'll see a home page, and what you should be doing is searching this patient by last name and date of birth. Last name, first name, and date of birth, and literally all of their information will pop up. So the first service we're going to talk about is patient snapshot. You don't really have to use this as much. It's something new that we figured you guys may want to use if you would like, but basically it kind of gives you just an analytical overview of what your patients have been doing over a year. We have different spans that you can put in. You can put in 1 year, 6 months, 2 months, a week, or 7 days. This isn't a good example of a test patient because it's not really much data. All we have right here is that they're doing some activity between August and September in the hospital. So if you see this blue circle, we have a key, and it means outpatient. Once again, this is not a good example because a patient that's going in and out of the hospital, you would see a lot of triangles and squares and everything in this area, but you can actually click on this circle and it'll open up and tell you that this patient has gone to specific hospitals, and if it was inpatient, outpatient, an admission, or discharge. I want to show you the next slide. This is the one that this is the service that you guys will be using the most, ENS Prompt. ENS Prompt, whenever you sign in, you'll get a moving screen of all your patients that have been admitted, discharged, and transferred. For example, this first one, Marty Quinn, he should be right here, but when you just click on one, it'll open up into this screen. It'll give you the patient's demographics along with the PCP that they saw when they were in the hospital. It'll also give you the event, basically the admission date that they went into the hospital. It'll also tell you what type of event this was. So I'm sorry, this is a discharge, not an admission. And it'll give you the hospital that the patient was discharged from, and it'll also give you their diagnosis and what happened to them and everything like that. When everything is marked in red on this side, this means that you have not clicked on it. So this means that you have a list of patients that are coming in that you need to follow up with. So for example, with this patient Marty Quinn, you'll call and say, hi, I'm calling from Dr. Smith's practice, and I see that you were discharged from the hospital last night. You need to come in and make an appointment with us. And once if you get that patient on the phone, we want you to make an appointment and put this in the EHR. If you don't get the patient on the phone, you can actually mark this as not complete, and you could actually change it to yellow, meaning I need to go back to this patient and get them an appointment. Once you do make an appointment, you actually change this to green, just letting you know, hey, these are the patients I've made progress with, they have an appointment. And it'll also be really great if you're just marking everything in your EHR. We had 7 admissions today. We had 10 discharges. I made 5 appointments. These patients are coming in. I couldn't I couldn't get this patient on the phone. So basically, we want you to use ENS Prompt so you can do follow-up care coordination, so that you can get these patients back in the hospital so that they aren't readmitted into the hospital again because you weren't able to reach them for a follow-up appointment where they could come in and see their PCP. Care alerts. How many of you have heard of care alerts before? So Chris does this new thing with care alerts. So basically, this is a short description of critical information for patient care generated by Chris participants. When you want to we actually have a section, I'm going to back up, in our snapshot page, and care alerts are actually down here, and I'm so sorry that they cut it off. But basically, care alerts are for the provider that they're seeing in the ED, because this provider, they've never seen this patient before. They're helping them, they won't have any history of what they've done. So they would go to Chris and go to their snapshot page, and they would go to care alerts, and basically they would see whatever information that PCP put in. So we actually want you guys to start sending us care alerts, but this is an additional task that you would have to do besides sending in the patient demographic list. So I just want to back up for a bit. How many of you are familiar with the patient demographic list that we require every 30 to 90 days at CRISP? Okay, so I just want to talk about that a bit. So in order for you to get services, in order for you to get these hospital alerts, we must know who your patients are. And basically we know this information from a patient demographic list that is generated from whichever EHR that you're currently using. In that demographic list, it consists of first and last name, date of birth, their full address, their gender, and a telephone number. We like to get this every 30 to 90 days because we just want to know who your patients are. If we don't know who your patients are, we're not able to send you an up-to-date list every day of who your patients are that have been admitted and discharged. So unfortunately, if today's September, just saying you sent in your last patient demographic list in March, we may terminate you. Prior to terminating you, someone will reach out, either me or your probably our support team, saying, hey, you know, we need to get an updated list. We have no idea who your current patients are, because most of the time, if you sent in a list in March, I'm sure you got new patients since then. And if we don't have a list of those new patients that has come in since March to September, you will not get notifications about them. So if you are in the MDPCP program, I just want to make it clear that you should be sending in patient panels monthly. If you aren't able to do that, your CRISP outreach rep can assist you. Yes, question.
I sent in my patient demographic last week, and I got an email from them saying that you all got a new system, and our patient demographics are not compatible with that any longer. But our system is not able to make it compatible with yours. So what are we doing next?
Who's your CRISP rep?
I don't know who it was, but I don't have.
Okay.
I think it was a support. It was Josh. Josh, that's who it was.
Okay, so that's someone from support. So we would have to work with you to see exactly, you know, what we could do on our end to see how we can send in this list. So
Like he wanted to work with me. He said we had to comply.
that's why see, he's from support, and that's why everybody is assigned a rep, because most of the time they answer the phone, they'll tell you what's wrong, but that's why we like for everyone to have a rep. And once again, the person that we had in Eastern Shore, believe they left, and that's why I'm here, because I only cover practices in Howard County, PG, and Montgomery County, but I have no problem with helping you guys. So with an issue like that, it'd be best for you to work with, you know, someone like me that can kind of figure out what's going on. But you said you have a new EHR, right?
No, you have a new EHR. He said you have a new system, and I've been sending these demographics for years now.
And he told you that we had a new system. Okay.
Where are you? Look, where are you from? Cambridge.
I'll give you my business card and we'll figure it out, because we have a new website, but we don't, and maybe it's something different that they have on their end. But like you said, if you've been sending them in the same way, it's no reason why all of a sudden he can't accept them now.
Right.
I'll just tell you, he's new.
He's that theory, and then you switch to unified landing.
Yeah, but that,
something with that.
yeah, but that has nothing to do with the panel. That has nothing to do with demographics.
I have a
So
question about the panel though.
Mhm.
So when you're sending in the panel, however that's generated,
Mhm.
are you talking specifically a panel just for the ENS alerts?
Well-
Or are you talking about panel just in general, like our Medicare patient panels?
And see, that's the thing. Prior to the program, you would just send in, prior to MPPCP, you would send in a patient panel of all your current patients. But for this program, we don't want just Medicare patients. It depends, because once you get the alerts in, you'll have to filter out just who, you know, Medicare patients are. So right now you're looking and you're like, okay, all these patients are coming in. This is not Medicare. I'm only interested in the Medicare patients. But we actually want you guys to follow up with everybody and not just specifically Medicare patients. It'll be great if you can do Medicare patients along with the other ones, because everybody deserves a follow-up call. But basically, to answer the question, you would send in a patient panel with literally every patient that has come into the practice.
So it's literally, that's what I'm asking.
Oh.
And I apologize. You're looking for practice level panels.
Yes, just demographics.
Full demos.
Yes,
Okay.
and to take it, yeah, and I left this part out. It should date back to 12 to 18 months, because we believe that, you know, patients that have been coming in the last year will return. But if you want to send anything before that, you know, it's fine. But some panels will have like 5,000 patients in there. So we like to say, just take it down to 12 to 18 months. So, and you're welcome. Any more questions about panels? Okay. Oh yeah, so since we were talking about demographic panels, care alerts are a little different. So with the demographic panels, you'll put in the patient's first and last name, their date of birth, their gender, and their home address. And once again, this is all pulled from all generated from the EHR. This is not literally a manual process, because you'd be doing it all day depending on how many patients you have in the practice. But for Care Alerts, it's a little different. We do have different requirements. We like to know which insurance they're using. We like to know who's their provider. We also like to know who is your care manager. Do you have like a specific nurse or social worker or community health worker, somebody that's specifically, you know, working with your patients for this program? Sometimes it's, you know, front desk staff, but we do like to have, we want each practice just to have somebody designated that is checking these alerts every day and that is able to keep up with the MVPCP stuff, because I know there are different requirements every month that they want you guys to keep up with. But Care Alert panels are a little different for when you're sending them into us, because we do want a Care Alert section where basically the provider just picks maybe the patients that maybe have the most chronic illnesses compared to others, and we just want you to put in some of their information about them, just so that the provider at the ED can know, you know, what's going on, just main stuff. Oh, she has COPD. She usually comes in every 3 months, or, you know, she's a part of this program. We just want that information sent in so that the provider at the ED could know. But whenever you're ready to send in Care Alerts, we like for you to reach out to your rep, because it is a little more tedious than sending in a regular demographic panel. Yeah, so this is the part I was mentioning earlier. We want to know who the patient's PCP is, who their care manager is, so that when the provider in the ED sees this, they can call their care manager and say, hey, you know, I have Unique Moore in here. I'm looking over her Care Alert, and I just have a few questions. And this is an example of how the demographic panel looks. So we do like to have a medical record number or patient ID or chart ID, their first and last name, their complete home address, city, state, zip, their date of birth, their gender. We no longer take socials. We do like to have a telephone number. And this part from column C down to Q just mainly consists of the demographic portion. But here's the Care Alert part, where we like to know their care program, their care manager, who their PCP is. And the Care Alert section is where you'll put in whichever information you want to be in this Care Alert for that patient. And this slide is about ECQM reporting. How many of you are doing this now currently? Nobody. Okay, so basically participants will extract quality measures in their EHRs, either in QRDA 3 format or a list of numerators, denominators, and exclusions. Log into Caliper through CRISP to either upload QRDA 3 or manually enter values. So I do want to say that this measurement for this requirement for Maryland Primary Care Program it hasn't come about yet. So once you guys want to do this part, or once we get to this part, it'll probably be best to reach out to your rep or your practice coach from CMS. And Chris will submit a single file on behalf of Maryland to CMS at the close of the reporting period. So Caliper is another website, and we'll most likely unify it into the unified landing page without other services. But right now, Caliper, you guys, we haven't started signing anyone up with that yet. So that's why you guys are like, you know, I don't know about this. Or...
Well, I can say for us, for our level,
Mm-hmm.
it's being done, but not by us, by people above us.
Is it the CTO doing it?
Yeah.
Okay.
Somebody in our.
Okay, because I know the CTO, they usually send in panels and they're sending in Care Alerts, which is really good, so you guys don't have to do that. So that's awesome.
It's above our pay grade. It's somebody.
Yeah, and that's why I said it's usually, you know, good to have somebody else specific that is checking everything. And most of the time at the CTO level, they do have usernames where they're checking this stuff on behalf of you guys as well. Using reports to identify high-cost providers. Okay, so this is all about CRISP reporting services. How many of you have access to CRS? How many of you like CRS? Yeah, CRS is a little different. And I know it's a lot of data in there, and pretty much you're only using CRS when it's time to do those reports. And when you do the reports, are you guys doing the reports, or the CTO or the coaches? Is anybody assisting, or are you guys just doing this? You have assistants? Yeah. That's great. Because the report stuff, it gets a little complicated. So basically the reports include all of this information, population summary, base versus current year comparison, demographics, PMPM trends, a lot of key metrics. And basically you can drill through all of these to get the beneficiary list and claims. I do want to tell you that when you are doing your quality reports for CMS, the only metric you really need is the inpatient admission / ER visits per 1,000 and the readmission rate, because I've seen the way the reports look, and they'll ask you questions like, how many patients have you had discharged that went to this hospital, in this hospital? And basically when you click these specific tabs, these two, it'll give you that information. Most of the stuff you can read through it if you want, but you really don't need those when you're doing your reports. Okay, and this is mainly for the CTOs, because like I said before, most of the time the CTOs have access to all of this stuff that you guys are doing as well. So you probably won't need any of this stuff. And this is an example of how some of the metrics and graphs and everything look for in this particular website, which is the reporting services. So basically we have new features, and the new features are basically that we have unified all of our services into one page. Prior to us putting everything in a unified landing page, if you wanted to get a discharge summary, you would go to one website. If you wanted to get admissions and discharges, you would go to another website. We had a lot of providers and users complain that, hey, I can't remember all of these different usernames. Why do I have to sign in here? Why do I have to sign in there? I do want to say, if you don't sign in every 90 days, you will be kicked out. So we want to just make sure that you're actively signing in and that you're still working where you say you're working. Another new service that we have is our user verification. So each practice should have a point of contact on file. And this is usually an office manager or somebody that is managing the CRIS portion at the practice. Every 90 days, an email will be sent out to the point of contact saying, hey, here are your list of employees we have on file. Do they still work here? You can check off yes and no. If you, for some reason, ignore this email, everybody will lose access. And I actually don't like it because I don't want everybody to lose access when they actually still work there. But this is just our way of making sure that everybody is there, everybody is saying who they say they are. Another new service we have is the two-way user yes, and everybody hates it. So basically, as soon as you sign in, CRIS will say, hey, we need this code that was either emailed to you or text to you. If you don't put the code in, you cannot sign in. And every time you sign in, they'll ask you for this code. And this is basically because we want to make sure that everybody is who they say they are. We don't want to have a data breach and we're on the news and stuff like that. And you know, sometimes you walk away from your computer, somebody's logging in, looking at medical records that they shouldn't be. So literally everybody at the practice who wants a username can get a username. You guys don't have to share, you know, login information with 5 other employees if you don't want to. And once again, these are all of our tabs that are featured into this unified landing page. Some people don't like it, but it is a better way so that you can just click in between tabs. If you want to see a discharge summary, you will go to health records. It's actually not called Query Portal. Sorry, this is an old slide. If you want to see, oh, here's health records. Query Portal is not supposed to be here. So for example, this is a health records tab. If you want to see, hey, a discharge summary, you go to health records, just saying you want to get some prescription drug monitoring information, you would click in that tab. If you wanted to see ENS prompt, you would click prompt. And it's literally that simple. No more signing in and out. You're just clicking in between the tabs. That's it. Yes.
How do we get new employees access?
You could reach out to your CRIS rep, or, and I know you guys, do you know who your rep is? Was it Josie or Lawrence?
So we're having an issue with
The rep?
not having access to
Mhm.
CRIS
Okay,
right now.
okay. Is it due to a panel or?
It's regarding a contract or something like that.
Oh, so this is different. Okay.
Yeah, yeah.
I would say our rep, I'm on the inpatient side. I think ours was Josh, but I think he's leaving. Is he the new one?
Yeah, Josh is the new one, but he's on the support, so he's on the phone. He doesn't come out and,
Josh is like, there was a rep, so like long ago it was Lawrence.
yeah, he's
Then it was
gone.
Josie.
She's gone.
She's gone now. We've been, in our CTO, we've been using.
Oh, you have Georgia? Yes.
She's not technically assigned to this area as a rep, but she's been the only one who's ever answered me an email.
Georgia?
problem. They don't have
A rep.
anyone that we know.
Yeah,
As a rep.
And I'll tell you why, and that's why they asked me to come today. Lawrence was an MD-PCP coach, but he left Crisp and went there to be a coach. He's not anymore. So they assigned Josie Eichner his role, but she just left like literally 2 weeks ago, and that's why I'm here today. And Georgia, I forgot Georgia's last name.
Delay.
Yes, so that's the thing. We're probably going to move her into this role so that she can help us because we're short on coverage. But yes, Georgia I think that she should work with us. But yeah, so the thing is, I'm glad that Georgia has been helping you. But you guys over here, I know you said that you want some employees to get signed up. I'll give you my business card and you can email me and we can figure out, because usually whenever there are a new group of employees that need to be signed up, I suggest emailing me so that I can track it and say, hey, they have access, sign in. I would have to look into Salesforce to see if you guys need to send in a panel or just look around and see what's going on. But as far as the users,
CTO, well.
what
she's
CTO are you
MD,
with?
I'm different, I'm a little bit.
Care transformation,
Yeah, Care Transformation Organization. So which one are you guys with? Do you know?
University of Maryland.
Okay. So they may be sending in panels for you guys.
Yes, they are.
Okay.
It's just we don't have access.
Okay, so we just need to get you guys signed in. So all everybody will need is a first and last name. I just need to know their title and their email address. But I'll give you my business card and we can coordinate that stuff.
We, at the CTO, we made a Crisp cheat sheet because it was a hard time getting all of our practices enrolled in Crisp.
Mm-hmm.
I can share that with you too.
And Georgia, you said is helping you, right?
Yes, she's been very helpful.
That's great.
She's done a lot of one-to-one in the practice.
Oh, she even came in and trained you guys. So we,
Georgia's here all the time.
yeah.
My speed dial.
Okay. Yeah. So, and that's the thing because I'm not in this county, so it's like I don't know where any of you guys are, but we'll most likely assign her out here because she's already working with you all. But for now, I can work with you all and we can go from there. Any more questions? No.
So she has one more slide just to
Oh.
to review resources, but before she jumps there, just to make all the technical / confusing or self-explained stuff that she shared with you now, bringing it back home. One key takeaway from an implementation standpoint is if you look at the CRISP report and you see your high volumes specialists there, identify who they are, at least the top 2, top 3. Then establish a collaborative care agreement with them. And these are the steps of how you can do that. This is also a requirement, but more importantly, it's a way for you to provide comprehensive wraparound care for your patients. So reach out to the specialists, request a meeting with them. They already know you anyway. Discuss that about having a collaborative care agreement in place. Draft a collaborative agreement for discussion, meet with the specialist, review it before you guys finalize, and then have at least a bi-monthly meeting to discuss progress. Here is an example, and I believe it's on Connect, but if you don't find it, we can also make sure that we meet up with the practice coach to post it as well. There's an example of what the collaborative care agreement is. It's a transition of care. So what's the mutual agreement here? It says maintain accurate and up-to-date clinical record. What are the expectations on the primary care side? What you'll do is transfer information and provide patient with the specialist contacts. On the specialty side, what they'll do is provide a single source contact person for you. And also when the PCP is concerned about appropriate labs to do, they will be there to support you. And then another category will be access. What's the agreement here? That you will be readily available for urgent help. The expectation on the primary care side is to determine a reasonable time frame for specialist appointment, and on the specialty care side to have a timely consultation appointment for the patient. Another category here is a collaborative care management to define responsibilities between the PCP, the specialist, and the patient. On the primary care side, your responsibility expectations are to suggest a type of transition of care, and also to resume care of patient whenever the patient returns from the specialist. And then for the specialty care, for them to review information that's sent by the PCP before they see the patient, and also send back timely report to the PCP about outcomes. And then patient communication. So this is just how simple it can be. You can pick just 2 or 3, but having that in place is not a formal documents that you're going to sue them if they don't do it, but it's just kind of having a more formal conversation and, bi-weekly meetings, say, how are we doing in terms of working well together? So, post survey question.
I have one more thing to say to them.
There you go.
And this is my last piece. If you have any questions about anything, such as, I don't know how to send in a panel, or I don't know who my rep is, or, we just need to sign in, or we don't, if you just have any confusion, I'm going to leave my business card so that you guys can email me, because I know some of you said that you didn't know who your rep was, and they're supposed to literally come in and offer training, onboard you, offer a presentation. So I don't want anybody, to feel like, they can't sign in, or they don't know how to use the website, so we're not signing in, or, just anything like that. So I know that we're trying to work out who's going to cover Eastern Shore. It'll most likely be Georgia, or maybe me. I guess I don't mind driving back over the bridge for you guys. But yeah, I'll leave my business card, I guess, with you. And if you want it, yeah. And you guys can just reach out. We can just figure out and go from there, so that everybody can, sign in and check the alerts and everything like that.
Good.
Thank you.